Hi, I'm Linda, pharmacist and founder of Beyond KP. And today's chats, we're going to look at the anatomy of keratosis pilaris, how it affects our skin, and what we can do to prevent it. So keratosis pilaris is caused by a buildup of dead skin cells forming a keratin plaque or like a pimple-like bumps. Now with these pimples, they tend to be about 10 to 100 of them accumulating in one area. And that area could be on your arms, your legs, your back, your buttocks, or even the side of your cheeks as well. Each of these pimples, they tend to be 1 or 2 millimeter in size, so they're very, very small. And that's why they have a common term that people normally describe as goosebump skin, chicken skin, or sandpaper skin. You will find with these pimple-like bumps, they tend not to have any pus in them, and they tend not to have any cyst. So they're actually very, very small. So a keratin plaque extends deeply into the follicles, causing damage to the actual hair follicle themselves. That results in swelling, inflammation, and permanent damage to the root of the hair follicle. It also affects the sebaceous gland, which is the oil-producing glands. Now, this gland is so important in our skin barrier function because what they do is they produce a complex of oil, triglyceride, wax esters, squalane, and cholesterol. And their function is to keep our skin hydrated and lubricated. They also help to prevent water from being lost from the skin, and they protect things from entering into our skin. It also has an antibacterial and anti-inflammatory function. So if these sebaceous glands are damaged, as you can see, it's very detrimental to our skin barrier function, and it's also cause our skin to be very dry as a result of that. Another issue with these keratin plaques is actually damage to the way our hair grow. So instead of a hair growing straight and onto the surface of the skin, it actually becomes brittle, it breaks easily, or it forms like a curl-like structure and it gets trapped inside our skin layer. So over time, this can actually lead to description like ingrown hair. And if you have that on area where there's actually a lot of hair, so if you have keratosis pilaris on your face or around your eyebrow or even on your scalp, that actually can lead to hair loss and alopecia. So you often hear people describe that keratosis pilaris is actually better in summer and worse in winter. And there are a few reasons for that. So one of them is actually the weather and the humidity in the air itself. So in winter, there's less humidity, the weather is colder, so we always tend to have the heater on. And when the heater is on, then we just, increase water loss from our skin, makes our skin drier, and therefore, increase the risk of keratosis pilaris. The cause of keratosis pilaris is still unknown, but there are some genetic links that has been identified. So especially if you have a family member that has keratosis pilaris, then you likely could develop it as well. Other links can be considered, which are hormonal changes. So you find that keratosis pilaris tend to get worse during adolescence year. So it says up to about 80% of teenagers do get keratosis pilaris, and a lot of them, they grow out of it as they get older. But for about 40% of the adolescents, it actually continues into their adulthood. So it can get flares up again when, especially as women, when we go through stages in life. So for example, if we go through hormone treatment therapies or IVF, we go through pregnancies, premenopause, menopause, all of those situations can actually flare up KPs again. There's also a link to dry skin conditions. So if you suffers from like eczema, dermatitis, psoriasis, then you're more likely to get KP. So we also will talk about malnutrition a bit later on in our next few series, but it is found that vitamin A and vitamin B12 deficiency can actually increase the risk of developing keratosis pilaris. Other existing health conditions that you currently have, which can impact the severity of KP or cause the KP to flare up even more, and that could be obesity, diabetes, hypothyroidism, which means your thyroid level hormones is too low. And the common understanding is that low thyroid hormones causes dry skin, and dry skin flares up KP. Cushing syndrome, which is when you have your cortisol levels too high. And if you do suffer from those kind of medical conditions, it's good to have a chat to your doctor, especially if your KP is flaring up even more, and they can do an overall checkup for you. So when should you really see the doctors regarding to keratosis pilaris? Normally, because it is a cosmetic condition, so most of us, we don't tend to go and see the doctor about it. But however, if you notice that your pimples are a bit more inflamed, red, painful, pussy, that's especially if you have been scratching at it or picking at it quite often, that could be a sign that it has developed into a bacterial infection or folliculitis. So therefore, the doctor would need to assess that. Other situations is that if you have, for example, uncontrolled habits of picking at the pimples or pulling out the scabs, or where there is significant scarring onto the affected area, then that should also be a good time to have a discussion with your doctor as well. Really hypo or hyperpigmentation to the area, what that means is that because the hair follicle is inflamed, it actually causes the skin to become scarred and also becomes pigmented. So, due to the inflammation, which means the skin color will change. For some of us, it remains as a flesh colors with those bumps. Some of us, the bumps becomes a bit more redder. And for people who've got a darker skin tone, it actually can develop into brown or black pigment marks. And that can be quite unpleasant and can affect our self-esteem. So if you notice that your marks are really dark in color or really light in color than your normal skin color and it's concerning you, then that's when it's a good time to have a chat to your GP about it as well. So if you notice there's significant hair loss to the affected area. So we talked about earlier how with KP the hair becomes brittle and dry, and instead of growing straight upwards, it actually curl up. So especially around the face area where the eyebrows or even the scalp, KP can cause the hair to loose, and another term is alopecia, and that can cause a bit discomfort to us as well. So it's good to talk to your GP about that too. So what can we do every day to prevent our keratosis pilaris from flaring up, or just to prevent the severity of it? The first thing that we can do is optimize the humidity in our surrounding area. So for example, if you live in an area where it is highly humid, then that's good, where there's always moisture in the air. But you live areas like myself, I'm in Melbourne, Australia, where it's actually quite dry, especially in winter, and there's not enough humidity, not enough moisture into the air. Having a device like a in-home humidifier for my office or for my bedroom that will actually releases small vapors of water into the air and just help to bring back the hydration into my skin. So second is to use a mild soap cleanser. So for example, using things like a soap-free cleanser or sulfate-free cleanser that is gentle on the skin, pH balance. Again, we just don't want to think anything too harsh that will actually strip off the oil, the little oil or sebum that we have left on our skin. So we want to use something that is quite gentle, that actually nurture and protect the skin barrier further. Moisturizing is really important for us who have keratosis pilaris. So when you use your treatment for keratosis pilaris, ensure that it is a very thick, rich cream. And if you need to, you might need to lather on extra moisturizer on top. And you would need to do this on a regular basis, day in, day out, week in, week out, month in, month out. And it needs to remain consistent because like we talked about before, the sebaceous gland where sebum is being produced is being damaged. So there's not enough oil being produced naturally from our skin layers. So we want to use the moisturizer where there's a lot of lipids, a lot of water base, a lot of antioxidants in there that will help to. So we want to use a rich cream that actually will help to replace back and protect our skin barrier again. In winter, it's so easy to have a long bath or long showers because the weather is so cold. You just want to stay in the shower. But it's actually really important if we have KP or we have dry skin or eczema to actually control the duration of our bath. How long you should ask? We try to actually encourage to limit down to one song. So that's your average 3 to 5 minutes. It's not one of those techno songs where you drag out for 20 minutes, but you should keep it as short as possible. Go in, go out. And it's good to even train our children who have dry skin to actually get into that habit as well. Is that stick, your shower time or your bath time to just 3 to 5 minutes. And try to use lukewarm water instead of using hot water. Again, that will help to prevent the water from being evaporated from our skin. And lastly, we actually want to avoid skincare products or household products that are containing chemicals, ingredients that are highly comedogenic. And comedogenic ratings are a rating that tells us whether an ingredient is likely to clog up the pore to less likely to clog up the pores. And it all depends on the concentration that are used within the formulation themselves. But these ingredients that I'm listing here are general ingredients that you will see in skincare products and in household products. And if we can best to avoid them, especially when we have KP, and the same if we have acne. So some of those ingredients could be your coconut oil, coconut butter, your coca butter, your algae extract, sodium lauryl sulfate, sodium laureth sulfate, isopropyl myricate, and isopropyl palmitate. So these are the common ones. There are more than that, but the others are not as significant. So if we start looking at our products and learning to look at the ingredients, and if you see this, it's good to avoid them. Or if you use them, just notice, does it make a difference when I use this product? And does it make a difference to my KP when I actually stop these products? Now we're getting to the main point about keratosis pilaris is how do I manage these bumps? How do I get rid of the rough skin? How do I manage the little pimples that are always there? And today I'm just giving a brief overview. Next week's session, we're actually going to delve into in a lot more details. We're going to look at each individual ingredients and we're going to look and compare them and see how they are different. So today, again, is just an overview, okay? When we look at keratosis pilaris therapies or treatment or management, there's actually one thing that we really want to remember by, and is that keratosis pilaris is a chronic skin condition. And what that means is that it is going to stay around. It might not completely go away. And so when you have your skin and you look at it, if your rating of your skin was, your KP was 10 out of 10 before, and you use a treatment or you use a cream or you use any laser or anything, and it goes down to about 3 or 4, that is a satisfactory result. So you might not get rid of those bumps completely, you might not get rid of those marks completely or the pigmentations completely, but if there's a reduction in terms of the severity, then that's a sign that it's working for your skin. Secondly, when we talk about treatment for keratosis pilaris, a lot of them will actually help with exfoliation. So exfoliation is about removing the upper skin layer, just allow the keratin plaque to come out. Now with exfoliation, everything gotta be in moderation and into consideration of the ingredients and how long we use them for. So treatment is gonna be for a period of time. However, it's not going to be for long term. What that means is that you need to use it for a few weeks before you see the result. But once you start to see the result and you're happy with the result, you actually need to stop using them. You can't keep going to use the exfoliating, whether it's chemical exfoliation or physical exfoliation, for a period of months or years, because that will actually irritate the skin barrier further. And again, remember the sebum, and it's not being produced. When the skin barrier is damaged, that actually can cause your KP to actually flares up more, the skin to become more easily irritated, and that's where you get the stinging, the redness, and the uncomfortable sensation. So some of the ingredients that you may have seen that are on the market for keratosis pilaris would be your alpha hydroxy acid. So that contains your lactic acid, your glycolic acid. So they help to exfoliate that upper layer of your skin. Then you got your beta hydroxy acid, which is salicylic acid. And that one there, it actually digs a bit deeper, so it goes a bit deeper into the skin layer and also helps to exfoliate. Then there's urea, which is one of the mainstay treatment for keratosis pilaris. Other options that people go for would be for laser therapy. So that's a laser treatment, and we'll go through a bit more about which type of laser treatment is shown to be effective for KP. Laser hair removal has shown some efficacy as well. And in some cases where the KP marks are actually really inflamed and red, you might see some your doctors prescribe you like a topical corticosteroid or even a vitamin A derivative retinoid cream to help to reduce the cell turnover and to help reduce the redness and the inflammation to the area. Again, that's a very quick overview. So I'll see you again next week where we're actually going to dig into these ingredients further and really explore them as a whole. Thank you so much for watching. See you then.